Everybody, this is Dr. Kamel and a new video in my series of BT license examination preparation. And the title of this video is BT license exams and Dr. Kamel advices. So it will be like several videos. This is the first one, and it will be talking about mistakes we do when we are preparing for license exams, good things we have to do, and how to prepare. This will cover several exams: the NBT, National Physical Therapy Exam of United States, the Physiotherapy Competency Exam of Canada, and also the Australian exam. So it will cover several ones, so as these are general advices from my experience in teaching in this field. So our title today: why most students fail the BT license exams. What is the brutal truth about that? Because sometimes we don't face ourselves with that. Sometimes we put the blame on others. Like we say, okay, exams are very tough, very difficult. They didn't give us enough materials in our university or school. I didn't have much time as I am very busy with other stuff. I have prepared myself very well, and I don't see any point why I failed this exam. But we need to dig deeper and search for some reasons for failing the license exams. So, if you think failing the BT license exams is about being not smart enough, you are completely wrong. It is like everything, needs preparation, needs a plan, and needs work. So you have to plan right. You need some guidance. That's why people who join my course, I always give them guidance how to prepare for the exam, and you need to put some work, some hours, some effort until you finish this exam, which is once in your lifetime exam. So let me be very honest with you. After teaching the BT license exams since 2017, I am in teaching since 1998 in university overall. But in specifically teaching, the physical therapy license exams, I started my course in 2017. I have seen one pattern. Students don't fail because they lack knowledge. They fail because they study the wrong way. Okay. Like it is a puzzle we need to solve together. We need to follow certain steps in order to make sure that we will pass this exam. So let's look at these reasons. Okay. Number one, passive studying. Reading books, watching videos, but not testing yourself. You are not answering any questions. You are not taking any exams. You don't know if you can retain the information, if you can analyze the information, if you can apply the information. Do you really understand the concept or not? So these PT license exams is not just memory exams, memorization, pure memorization. No, it is not like that. It is mainly a clinical reasoning exams. So yes, we explain the concepts, we explain the definitions, we explain the basics, but we need to apply that into our clinical vignettes, into our questions, and so on. So we need to mingle this information into a meaning thing. Number two, no strategy. You are doing questions randomly. Okay. So you don't understand the content for the exam. You don't understand the weight for each category. You don't know what to start first, then how you proceed next. So there is no system, no review method, no tracking of weaknesses. Number three, ignoring weak areas. Okay, I am answering questions and I am seeing myself answering musculoskeletal questions very well, very strong, getting almost 100% on these questions. But I am always weak on questions involving the cardiopulmonary section. For example, I'm giving you some example here. Okay. And I'm ignoring that. I said, okay, it's okay. I am weak in cardiopulmonary. Yeah, we have to face it. We have to work on that weak section, on our weak points. We have to make a list of the concepts or the stuff which I don't understand, and I am always answering these incorrect, and how I can improve my scores on that. So most students avoid, for example, cardiopulmonary, neuro, or modalities, and this is exactly where the exam will hit you, because I cannot lose all these questions on the exam, and at the same time I will pass. For sure, I will fail the exam. We have to give attention and for each section of on that exam. So I cannot ignore some areas and say, okay, I'm weak on these areas. I will ignore them. No, it doesn't work this way. Number four, poor question analysis. I have seen students, they read too much, they read textbooks, but when they see the question, they don't understand what is this question is about. That's why I always answer question on this channel, and because we need to understand the question. You get the question wrong, and you move on. You don't do deep review, so you do the same mistakes again and again until on the exam day you do the mistake again. Because if I am doing this question wrong, I need to understand why I got this answer wrong. Maybe I don't understand enough the signs and symptoms of Parkinson disease. Should I go back and read about the signs and symptoms of Parkinson disease? I'm giving you an example here. Okay. Number five, burnout plus inconsistency. Some students are studying like 10 hours one day. I have seen a student, she approached me and she failed this exam 3 times. She's studying too much, she's reading too much, and she does not get any rest. And so, like, she's studying like this abnormal pattern, studying for 10 hours one day, then nothing for 3 days. So, it doesn't work like that. We have to distribute our study hours, 3 hours, 4 hours a day, but we have to be consistent over 3 months, 6 months, until I make sure that I am ready for this exam and I can take the exam. But I cannot not do one shot and that's it, because this exam is different. This exam is not covering one subject like you are studying in a university, and this is one subject you are learning this subject, you're going for exam. No, no. This exam is covering all what you have or had studied in your BT program, which is huge content. So when I am preparing for this exam, it needs consistency, it needs stamina, and I need to plan my time so I don't get this burnout. So now, after we learned about the most common causes of failing this exam, Now this is our turning point. Okay, we need to talk about the students who pass this license exam. What they have been doing? They were doing one thing differently. They study actively, not passively. They think like they are clinicians, not students. This is a 34 years old female patient come to your clinic with pain around her ankle after sustaining and after her ankle was twisted yesterday, blah blah blah. This is a clinical case. This is a clinical vignette. I am dealing with this as a clinician, seeing this patient in my clinic and thinking about examination, intervention, stuff according to the question over there. But I am thinking like a clinician, not a student. Okay, and this may makes a big difference. Believe me, think this way, and you will see much difference in your performance and your answering questions. So if you want, I created a free BT license exam study plan that shows you exactly how to fix these mistakes. Subscribe to the channel and watch for the coming content. And I have prepared some valuable content and also working on preparing more. So please subscribe to the channel and invite your friends and colleagues to subscribe. Thank you, and I will see you soon in a new content.